Hello and welcome to the sixth in our series of podcasts for the Coalition for Life Course Immunisation. My name is Gary Finnegan. I'm a health journalist and editor of Vaccines Today. I'm also a trustee of the CLCI, the Coalition for Life Course Immunisation. This series has explored how to make life course immunisation a reality in Europe. We've interviewed health professionals and civil society groups, economists, but politicians play a key role in turning the theory into practice, into reality. And today we're delighted to be joined by two members of the European Parliament, Tomislav Sokol from Croatia and Vytenis Andriukaitis from Lithuania. Gentlemen, you're both very welcome. Thanks for joining.
Thank you for inviting.
You're most welcome. And the reason we have you today is to focus on the launch of a new MEP Interest Group on life course immunisation, of which you are co-chairs. To begin, MEP Sokol, could you tell us first what is an interest group? Because not everyone will know about interest groups. And how does this interest group's mission align with the European Parliament's priorities for this term?
So again, thank you very much for inviting me for working on this very important issue, which was one of the most important issues in the last years in terms of public health in European Union. But now I see a bit neglected. So I think that's the main mission of interest groups. So that's kind of a less formal way of organizing MEPs with different stakeholders. But the main objective is to raise awareness of some of the very important issues that we are working on in the European Parliament. And I think in terms of protection of public health, helping member states building their health resilience, but also focusing on prevention, and vaccination definitely is very important in terms of prevention. I think these are things which definitely align with what we are doing in the European Parliament. We know that healthcare systems are under pressure in terms of increasing costs, increasing expectations from the public, and here vaccination can really play an important role, because vaccination, I would say, is health treatment which probably saved the biggest number of lives in the history of the world in terms of making people in terms of in terms of preventing deaths, preventing diseases, etc. And it's probably the most cost-effective way of treating people, because it's because we are preventing diseases, we are preventing the rise of healthcare costs, we are preventing the need to undergo patients with many very expensive health treatments, medicines, etc. So in that sense, vaccination is very important. And also one last but not least point, and that is reducing health disparities across the different member states, because we know that there are unfortunately different standards of healthcare provision, different situations in terms of access to healthcare in different regions of European Union. And I think the main objective of European Union in this mandate should be that to make sure that all patients in all European Union have the same access to healthcare, same access to health treatment, that we don't have first and second class citizens. And in that sense, promoting vaccination, visibility of vaccination, raising awareness, building infrastructure, etc., is definitely of extreme importance.
Thank you very much. And Dr. Andriukaitis, why do you think it's important to have a broad coalition of stakeholders and across the political spectrum supporting life course immunisation?
First of all, let me tell you, European Parliament is house of democracy and house of people voices. And our voice telling to our friends, our citizens, should be heard, and especially in time when we see a lot of misleading information about vaccination and so on. Our goal is to say simple message: vaccine saves lives. Vaccines save lives. And of course, we need to understand that it is a good opportunity to stay as healthy as possible, as long as possible, and to prevent big threats like infectious diseases, pandemics, epidemics. We have a lot of challenges around us, and such democratic voice should be heard in European Parliament. And we need all stakeholders together. We need our citizens, we need our members of European Parliament, we need our, civil organizations, we need scientists together, And interest group can help us to elevate issues high on the political agenda and high on the public discourse. We need to have public opinion on our side. We need to see much more positive approach to vaccination, especially on life course vaccination, because we know how many people we lost because of COVID, and we lost a lot of people, oldest people. And of course, we need to say now very clearly, it is our goal is to strengthen, to strengthen such positive message about possibilities to prevent diseases and to protect people and encourage people to participate. And this interest group can help us to show that importance of life course immunization.
And how does the interest group help your own personal political priorities?
My own?
Yes, yeah.
Of course, being medical doctor, I vaccinate myself all my life, and now I am vaccinated against influenza and against COVID once again, and of course also against pneumococcus and the different types of viruses. And I can show you by personal example. I need to stay as healthy as possible, as long as possible. I am 73, and for me it's now very important to be safe and to stay in society and not to transmit infectious diseases from me to another person. I am very proud that I vaccinate myself and I protect my friends around me. I am not, not a person who can, disseminate viruses. I protect myself, and I am protecting all around me. It's very important message.
Good to hear. Good to hear. And me too, of course. I'm also fully winter vaccinated this year. And MEP Sokol, maybe you could tell us a little about how the interest group affects your own work and your own political priorities. Of course, this means additional workload and more meetings, and you're all very busy. So what motivates you to take on the co-chair of this interest group?
As I said, public health protection is one of the most important missions, one of the most important political objectives that we have in European Union. Even though healthcare is primarily a national competence, EU can really do a lot, and it can do much more than it's doing today. The most important thing now, in the beginning of this minute, is to retain this focus on health. Because healthcare prior to COVID, prior to Europe's beating cancer plan, was a marginal topic in Brussels. That has changed. But now we see again we are losing momentum. So we see the reduction in EU health budget. We see that it's not in the focus on different discussions. It's not that emphasized anymore, and that's a problem. So we have to change that. So my most important thing in terms of protecting public health, making sure that all European citizens have access to same health treatment, is that we retain this political focus of European institutions. Concretely, that means that vaccination is important because public health threats, pandemics, for instance, contagious diseases, etc., are problems which transcend national borders. So when they have an epidemic, this is definitely a problem which member states cannot solve by themselves. So EU has the biggest role to play in such areas. And I'm glad that I was member of the special committee on COVID, on lessons learned from COVID-19, when I actively participated in making the report on what EU has done during the pandemic, but also what you can do better. And I think these kind of recommendations, suggestions, lessons learned from what we've done before are extremely important. The second very important issue is the European health data space that I've been working on as the rapporteur. And definitely European health data space is a real breakthrough. So this is one of those few pieces of legislation where we actually create something new. And the idea is that we have harmonized data sets across Europe, that we can use data for treatment, for research, innovation, creating new medicines, new vaccines, etc., but also to make vaccination strategies, public policy decisions, etc., etc. So we'll be able to gather this data across Europe much better than before. We'll be able to access much bigger amounts of data than before. And in terms of making strategies, in terms of having comparable data so that we can compare what's going on in different member states, that we can coordinate different national approaches, having this data and implementing European health data data space is of enormous importance. So I'm glad that I was able to participate in that, and I'm convinced that we are able to get it right. The implementation of the European health data space that will be able to have much better vaccination plans, better strategies, more coordination between different national healthcare systems, and in the end, better healthcare for all European patients.
And can I ask you on the European health data space? So some countries are very good at collecting data, Denmark and some others, um, data on vaccine uptake and on outbreaks of disease. Is this the type of thing that could be in the European health data space, collected in a uniform way, or is it something else that could
Definitely,
come?
yeah. That's one of the many things that we'll be able to collect data with, to have common standards, to have common protocols, that we have data that can be compared, that can be exchanged, and that we can really have make this data help us have common European health policies. I remember during the pandemic, for instance, where different member states had different ways of calculating, for instance, the numbers of deaths, effects of different policies, etc. And if you have different criteria across different member states, then it's impossible to have a common approach, because for a common approach you need to compare the situation different states, see what works best, what are the best practices, and then implement them. But if you have data which cannot be compared, which cannot be shared, etc., then definitely this cannot work. So if we want to have common strategies, we need to have European health data space. We need to have all of this data available on basis of the same standards and same protocols. Unfortunately, the situation in different member states varies quite a lot. So you mentioned some positive examples, but there are still many member states where we have big problems in terms of gathering data, where GDPR, the General Data Protection Regulation, is interpreted very narrowly, where there are many obstacles in terms of using the data. Not to mention the fact that in terms of health infrastructure, digitalization of health data, there are also big differences. So in some member states, still pen and paper are used, which definitely is not the best way. So if we want to have real health policies, effective health policies, we need to have this digitalization. We have to have big numbers of data, big data sets that can then be used. We need to have them in digitalized format. So definitely the idea of the European health data space is to have a harmonized solution. So not that we have every member state with different rules and different standards, to have one common European system, and also to have a level playing field, which means that we will have to help those member states with less developed infrastructure, with less developed standards, with less developed digitalization and IT and use of IT technologies, so that they can catch up with those who are already more developed, so that everybody has the same standards across the EU, which also is directly connected to what I said in the beginning, which is my main priority, and that is that we have common standards and common access to common health treatments in all different member states. So I think that EHDS, in terms of harmonizing situation, unifying situation in different member states, unifying access to healthcare in different member states, and the use of health data, will play an enormously important role.
And before we move on, just briefly, what kind of timeline are we looking at for the European health data space?
So EHDS will be implemented in stages. So different things will be implemented at different times, but most of the things, crucial provisions, will be implemented within next 4 to 6 years. Which means, which sounds a lot, but in terms of knowing what an enormous task we have in front of us, definitely that's not a lot of time. So we need more investments from EU level. We'll have to help healthcare systems and motivate them to actually implement this, to introduce this into their way of working. But what is most important is we need to get health professionals on board, and we need to get patients' trust. So we need to explain to the patients that data will be protected, that it will not be misused by anybody else as outside of the people working on public interest issues, public health systems, national administrations, European administrations, and their data will be used for purposes which are of common good. And also, very importantly, that their data will not be misused in a way that somebody can re-identify them, that somebody can take away their data with them, etc. So data will be protected. It will be accessed in secured environment. Nobody will be able to download it and take it with them. And data will be anonymized or pseudonymized, which means that it will not be possible to identify individual patients. So all of these safety instruments are crucial to protect patients, but also to gain their trust, because without their trust, the system will not work.
Okay, good. And Dr. Andriukaitis, so some of the big things happening at European level, like the health data space, but also the European Health Union, how does this help us advance preventative health across Europe, given that health remains a member state competence?
I am a little bit in different approach. Now, we are staying in 21st century. You know that nobody can protect the pandemics without working together. Cross-border healthcare directive allow us also once again to understand why we need broader and broader cooperation between member states. Separation, national and international, is wrong approach. We are interconnected. Why we are speaking about the European health data space? Because we need to allow all Europeans to have better access to better treatment. Because without possibility to have big data, we have no chance to guarantee treatment of orphan diseases, of rare diseases, or developing personalized medicine. Why? Because all Europeans need it, not only national someone, but all. We need to understand once again, we need to think that yes, we need to have more harmonized approach on vaccine preventable diseases. Why? Because you have no chance to fight in one country against measles if measles outbreak is around you. We need much more understand that now it's time to understand we need cooperation on all levels and very active and very productive. When we are speaking now about harmonization of our national vaccination calendars, please look how many families are working in different countries and they are vaccinating their children. In one country is too early, in another is too late. And if you look into vaccine calendars, we see how many different approaches are there. And if we are speaking about life course vaccination, programs, we need to understand, we need to encourage member states not to stay alone, but to activate, to cooperate, because we need to once again to pass the idea about European Health Union as very important tool to solve problems on the ground. If you are speaking about life course vaccination, if you are speaking about possibilities to strengthen our national vaccine calendars, if you are speaking about possibility to access to better vaccines, if you are speaking about development of new vaccines, we are all speaking about common work in common field. Because the protection against infectious disease is a common. And now we have good opportunity to have in our hands, HERA, to have, crisis preparedness strategy, to see how member state systems are resilient, how they are ready to address new crises. It means that cooperation now is going up and up. And we need to understand now as never before that it is so important time to speak about financial means to support member states to have enough financial means to buy vaccines. Joint procurement agreement, very important tool. Can you imagine 20 years ago, nobody spoke about joint procurement agreement. Now we have in our hands joint procurement agreement, buying vaccines and buying personal protecting equipment. It means that we need to show how it is important to think in solidarity, to cooperate, and not to separate such as national, such as European. We need to understand common together and togetherness. And of course, especially in life course immunization, is so important to say about economic added value when we are proposing life course vaccination programs, which should be more harmonized and allow us to prevent premature deaths. How many premature deaths we have every year because of we are so weak in our common actions, in our solidarity. And of course, when I'm speaking about equality, when I'm speaking about access to treatment in every country, of course, we need to see that we have much more active actions at all levels, local, national, and European levels. You have no chance to separate those levels from each other.
Okay. Okay. Thanks a lot for that, and I think we can all agree with it. But maybe MEP Sokol, if you could maybe tell us how the the interest group on life course immunization could help to advance some of these goals in its first year. What are the priorities for the beginning of this group?
I mean, the general priority is to raise awareness, to raise the visibility of this topic in the European Parliament. As I say, we are seeing that kind of the focus on healthcare in the European institutions is getting a bit lost, and we have to fight to change that. I think that health policy is one of the most important policies of the European Union, and I agree with my colleague that big health problems, big health issues like pandemics, cannot be solved by member states themselves. Also, the question of access to medicines, the question of standards of healthcare. So we need common European policy there, and we need European institutions to get involved, to be active here. So raising awareness is crucial. So there are different ways how to achieve this. So first, by organizing conferences in the European Parliament, to getting stakeholders here, to have a discussion, to actually hear from them what are the priorities, what needs to be done. Also, by raising the issue in the meetings of the health committee. You know that we formed, and that's a big achievement, that we formed last month a new separate health committee. So before this, health was in the same committee with the environmental protection, which means that it wasn't really the main focus of the work of this previous committee. But now we have a separate committee, health committee, with all full powers to make legislation, etc., which also is a guarantee that healthcare will become more important in the European Parliament in this mandate. And so definitely, so raising the issue of vaccination in the discussions in the committee, in the plenary meetings as well. Also to have also to have different activities in terms of in-person and virtual meetings to define the early priorities. And also, what is important, what we should strive for, is to establish a scientific panel to provide evidence-based recommendations for advocacy and policy development in the area of vaccination. So a lot of activities, a lot of things that we can do, from scientific panel, conferences, discussions in the plenary, in different meetings, bringing stakeholders together in the events, in the conferences, in the parliament. So I think we should work on all of these fields. That we should prove that we are active, that we are visible in the European Parliament, and then we'll have concrete, tangible results.
Okay, great. And so, final question, same question to both of you. Maybe stay with you, MEP Sokol. What's your vision for 5 years' time, or the end of this term? Where could we be on immunization, on life course immunization, if we make the progress we want to make?
So I think the best way to measure progress will be to see vaccination rates in different member states, in different life stages, in different population groups. So if we are able to see concrete progress, to see the improvement in terms of vaccination rates across all of these different dimensions, then we will see that we've been successful. So that's the most important thing. Apart from that, obviously, greater integration of vaccination into EU health policies and strategies. It's important because, as I said, in terms of health planning, in terms of effectiveness, reducing costs, and having efficient results in terms of public health protection, vaccination is of utmost importance. So it needs to be integrated better in strategic documents in the European Union. And of course, raising public awareness of the value of vaccines and prevention generally is very important. But of course, this will be reflected in what I said previously, and that is to see the increase in vaccination rates. Of course, we will advocate for some additional things as well. Also engage member states, try to motivate them and stimulate them to increase their budgets for immunization. Also to have strong discussions with national ministries of health, and also to have better planning on the European and national level. So all of these things are very important, and also last but not least, to have greater alignment in vaccination policies across member states, which means that we have that in different member states we have since we have similar problems, that we need to also have similar priorities, that strategies need to be aligned. Of course, not everything can be the same because situation is different. Not everything is the same in all member states. COVID has shown us that. For instance, we saw that in the eastern part of Europe, we have a bigger problem with vaccine hesitancy, probably because of the lack of trust in institutions. So we also have to adapt certain policies there. But in a lot of things, I think we can have common priorities and alignment of different policies across EU level. So I think that we should work on all of these levels. So both on this European, but also on this more national. That we need this. coherence and this collaboration on both European and European and national level. I agree with my colleague on that. But the most tangible sign of progress and the way how to measure it will be to see the increase in vaccination rates across the European Union.
Okay, brilliant. Thanks so much. And Dr. Andriukaitis, finally, then your vision for 2030 on life course immunization. What do you dream of?
Vision is very simple in few words. We need to elaborate European adult vaccination strategy. We need now to encourage European Commission to go forward, presenting their view, proposing to all member states to follow such advice to have common adult vaccination strategy in all 27 member states. It would be a big achievement. And of course, also to promote greater alignment in vaccination policies across member states. Also advocate on increased national healthcare budgets for immunization. And of course, we'll discuss issues about how many, financial means we can deliver. Speak about crisis preparedness, because vaccination is part of crisis preparedness. And of course, encourage development of adult vaccination calendars as part of European health guidance. We need to have those concrete topics in our hands. And it will be good to develop those topics in those 5 years.
Okay, fantastic. Well, we wish you all the best with the MEP Interest Group, which launches shortly and will run for the next 5 years, and let's hope even longer, perhaps. But thank you both very much for joining us. Don't forget, to all of those who are watching or listening, that you can find all the episodes of our podcast series on the CLCI YouTube channel. Make sure you subscribe to get the latest episodes there. But for the moment, thank you both for joining, and thanks to all who listened and watched, and goodbye for now. Thanks.
Thank you, and bye-bye.
Thank you. Bye-bye.